I thank you so much for the introduction. Let us speak about the policy formulation. So I've got incredible guests for you today. Those are the representatives of those executive branch authorities which form the policy at the national level. So please, let's meet Mr. Oleg Petrenko, the head of the National Service of Healthcare in Ukraine. And also I'd like to introduce a person who maybe you know. It's Stanislav Gaidor, the head of the Drohobych Smart City project, and we will speak about the formation of the state policy at the local level. And of course I'd like to invite a priest, Father Pavlo Hud, who is the director of the School of Journalism of the Ukrainian Catholic University, who issued the first course of the formation of policy, which is data-driven. We'll speak about that, but I'd like to say a couple of words first for us to think how you see the perfect process of the formation of state policy. Just imagine Ukraine 2025. We are one of the leaders, one of the three leaders in open data world. How do we form the state policy? Just imagine the perfect state policy. I may say that here we have several options of the perfect picture, which will be equal to the number of people who are here, or maybe even more. But we will be united in one thing, that the state policy, the perfect state policy, is based upon the open data. We all understand that. But also it should be inclusive. That means that through the process of the today's interaction, each of us can impact the process of the formation of the state policy. It is adaptable and adjustable, which means that the state policy changes in the process, taking into account the consequences we have, and also it is formed taking into consideration the impact, the future impact onto each sector of the activities of the society. It has a certain cycle. It is formed, it is being implemented, but it goes through a certain stage of assessment of efficiency, and then taking into consideration this assessment, we get to the next stage of planning. And you can also add 3 to 5 to 10 symptoms or just conditions of the perfect policy formation, but still, the most important thing I'd like to say that the coolest policy will have the consequences for me as a citizen of Ukraine. It will take into consideration my interests as well. It will be efficient because it will be based upon the data and it will have cool analytical support. And in fact, today we will present very precise and specific practical cases at the different levels to show, first of all, that the state policy is you, and you have an opportunity either to make the people be aware about your position or to take part through any tool, through the e-participants. You are also an object, and I want you to be a subject of the state policy. Secondly, we will present the cases which show very specific results and very clear results, and this is only the beginning. We'll have more cases like that. We'll have more opportunities to say that we, as the people who are not indifferent to the open data, we improve the decision-making process at the state level, and we will begin with a very complicated point, a very multidimensional one, which is healthcare. Oleg, maybe you can correct me, but what is healthcare for you? Please remember and think, what is health for you? No diseases? An opportunity to move all over the city? To perform your functions, to achieve your aim in life? The World Health Organization says that health is the state of the full social, psychological and physical welfare, not only no diseases. So, translating that into the language of open data, we may say that the state policy formation process depends on whether the data are cool enough about the social status of the people, the economic state, the diseases, the healthcare, and so on. This is the huge bulk of data. And I'm really happy that Oleg is the speaker of our panel today. Oleg, I wanted to ask you the first question. During the formation of the state policy of the National Healthcare Service of Ukraine, you were the first who posted the data and made public the data about the state expenses on the provision of healthcare services in Ukraine. Would you please tell, how does it help you? How do the open data help you in the state policy formation, first of all? And secondly, what are the following steps in the formation of the policy of your institution? Good day, everyone. I'm not an expert in open data, so maybe I won't use some of the definitions in a proper way, which you already got used to, but still, I'll try to explain our position. I couldn't imagine that we are becoming the leader in open data, but what was organically happening and taking place when we were trying to solve a different issue with the help of policies. When Victor said or pronounced his introduction speech, healthcare is the proven process, and we would like to have healthcare which is compliant to the standards which exist in the civilized world. And the same happens with the policy. It should be data-driven. Our National Service of Healthcare is only a year and a half, and we had a very serious task to transform the system of healthcare. It's not a secret that the majority here are the young people. But still, maybe they are not engaged in the medical services processes, but still we know that we have a disastrous state of implementation of free medical services and support. I'd like to ask the audience now, could you please tell how many of you coming for any medical support, you could implement this right totally for free as it is foreseen by the acting legislation? Well, you see, a bit less than a quarter told about that. Other people maybe face the situation that the declarative principle which defines the obligation of the state to have free medical service when people need it led to the situation that the system had to be transformed. 2 years ago, there was the law adopted on the financial state guarantees of the medical service, and we didn't only declared the free medicine, but we wanted to find out the new situation when each person needs to understand what can I afford myself within those economic opportunities, what can be guaranteed. Not everything for everyone and always, but what exactly is guaranteed by the state in the package, and what's already paid from your taxes, and what is already proceduralized as a service, not just to construct the walls, the beds in the hospitals, the doctors, but just the services. This transition is a very simple change we are dealing with. This is the transition from input-based, that is, from the maintenance of the system to the payment of the services which were provided. We began with a very small organization, and we began a campaign on the 1st of April, Choose Your Doctor. Everybody knows that now approximately 70% of Ukrainians have chosen the primary doctor, and this is the entry point to the free medical services. And using that,
I hope that the other people who have raised their hands, there are the people who have chosen their doctor and they're already using the services of the doctor even with a private company, if they're ready to fulfill the main condition of the National Health Care Organization. And we're really happy that when we have seen how much resources the state has to change it, then we had to make some kind of a choice. And in what way we're going to be starting implementing that. Unfortunately, if we speak about project management side, then there is not enough resources, and we have to make a jump. We had to avoid something, not coming up through capitalism, from Middle Age to capitalism to all of the passes to postmodern. We just wanted to jump into it. The only way to jump into it was to use the technology that allow us to do that. So all of our choices have been based on data. And just to show something, as something goes outside the shadow or changes the structure, it is very important to show it practically. And we started to do that using the e-tools. For example, the declaration. Signing the declaration. In order to have this principle in place that the money follow the patient, we had to know where the patient is, who is the patient, and what institution they're being serviced, what doctor they choose, and how we can pay the money. Without the e-tools, it wouldn't have been possible. We retrieved this data, then we're giving it to the central public body that's worked with all of this agreement, and then we started to do all of these payments. And later on, at the National Healthcare Service, we have created these data sets that have been created by our colleagues. By the way, some of them are here, and I'm really grateful to those people because there wasn't a lot of us, and they have proved that open data is one of the cases how you can actually protect the new type of policy in its implementation. And now it happened that we have the opportunity to publish this data in the portal of open data, and National Healthcare Service was one of the first who started doing this. As soon as we've got this opportunity, we were the first who joined Trumbita program, and we've all started. I don't know why anyone did it before, so we tried to do it step by step. So we've joined it all, and we're starting to do everything using our variants of X-Road. So, in order to turn from the old paradigm, we tried to jump into trend, and this trend helped us to be open. You can check it out. You can check the site of the National Healthcare Service if you haven't chosen a doctor yet, so you can find the doctor now, how far this person is now, how many declarations this person has, what is the structure of the declarations. Just choose the doctor and sign up the declaration in order to receive the free of charge primary health care. And starting from the next year, the systems of financing the healthcare system is going to be developing in many different directions, and I do hope that with the help of the modern trends, in a year or two, more Ukrainians, more young Ukrainians, senior Ukrainians will be able to exercise their right to receive the free of charge medical help or medical services, and we're going to do that also with the help of open data. Thank you, Oleg. Thank you, Oleg, and I do hope that dynamics is going to be kept up. But I still have a question to you. Can you please tell us about the precise results that the National Healthcare Service can show on optimization and making the policies more effective based on the open data? Well, you know, the reforms that are not being done when you have a good plan, a good roadmap, when you have installed everything technically. You only start reforming when everything is not in place. You don't have time, you don't have resources. Then we only have the creative ideas coming. And when we have seen how much resources we have and how we should delegate the resources, there was no other way for us than to use the fully transparent tools. When we have just been founded, everyone told us that we're the corruption monster, the only owner of all of the money for the healthcare. And now all of the dark forces that would like to find some bumps in us, they go to our side and they understand that with this level of transparency of data, it's really hard to give some of accusations to the people who did that for less than a year and a half. I will give you just one of the examples. We couldn't make it without the electronic tools. We couldn't make it without it. And I already told it that we're going to start working with our state treasury without the support and documents, paper documents. They told us that it's not possible to do it like this in the central body. There still has to be additional forms that are going to be then connected to the register. We've completely did that, and we've managed to make it that even up to all of the payments, even the payments for example, available medicines, and maybe you have know that we have we have all the specific recipes are now being provided for the specific medicines in electronic way. So it takes a lot of questions that we can answer from us. Everything is open, everything's transparent. You have some questions, you can take a look at our site. Right now we started transferring all of this data to the open data portal. So anyone from businesses, from science, from academia can use this data for any kind of research they want. And I would like to tell you that together with the Ministry of Healthcare, we have a lot of plans in future, because my position is that all the data that we receive, they have to be used multiple times further on by the businesses, by academia, by the controlling institutions and bodies, whoever is interested in that. This is our main position, and this is what we're about to be doing. Thank you very much. We wish you all the luck, because with your luck and with your successes, our healthcare really lays on your successes. Okay, next question I would like to have to Stanislav Hejda, the person that represents the city authorities. And I do not know how you're doing, but people do not live at the state level. The people are living in communities, and there are specific people who are responsible for the residential services, for the provision of the medical services, of educational services, and all the other. I do believe you already are acquainted with Stas from our previous forum. He has been the winner of multiple open data competitions, but my main idea was to ask him, you're getting the data, you're publishing the data, but how do you use it? Remember, Professor Sullivan has said that there has to be the smart decisions in place. So smart decisions can only be based on open data. So, Stas, a direct question. Can you please tell us about your case of using the open data in order to create, design the policies, the policies, and what changes does the people of Drohobych felt with the open data? You know, throughout this day, together with Oleg Kotenko, I guess I will tell our case, Oleg Kotenko will tell about our case about medicine. When we had this registration of agreement between the doctors and patients, the doctors have started to have around like 1,500 declarations. Then we've had a very important assembly, and one of the heads has said, you know, we have only 50% of all of the declaration being agreed. Out of the 50, there's only 30 coming from the city. The city does not sign the declarations. You have made an announcement, and you have just put this announcement on the houses, on residential buildings, and that's the only way how it's going to happen. What we've said, we have the data already about the declaration being signed. Let us take a look at every doctor's account and just for them to see how many declarations they have on a specific location. When we did that, the doctors started to make a faster decision. They have suddenly understood that in the houses where they don't have declarations signed, they have people they're acquainted with, or they have serviced the people in the other houses. So they started to call in them, and we had more declaration being signed. The first months after we did that, we had more than 5% more of declarations signed. So we've saved some paper. There was no announcement, physical announcement made. Then paper was saved, and the doctors have seen what this is the impact of the data. I'm not only even going to mention the open registration office, so that not that the registrator works with the specific decisions of every doctor, but for the residents to identify where it's comfortable for them to visit the doctor. We also have introduced the remote signing of the declaration, not with the e-signature, but the person comes up to the moment to sign, which is a specific moment that is comfortable for them, the declaration, but then they're going to provide it to the doctor to do that. So the person would go not to the main hospital, not to create the whole protocol, the whole agreement from the spots, but only to sign it. And another point that was really successful for our city, that we have the data of all of the secondary education establishment over the city, and we show it to the people. We have 19 schools, and before that all of the mayors were afraid to close the cities, even though there are some schools where we spend 30,000 hryvnias per one person, and there was one schools when we have 9,000 hryvnias a person. So we have a school, for example, in a village where there's 100 people in there. and it spends 25,000 hryvnias for one person. Let us buy a bus, and the children are going to go to another school, and we will save 1 million to budget. On the other hand, we can, for example, give the 7 million hryvnias per the school, but we will not cover the issues of the infrastructure. Today, this year, we have closed one school in Drohobych. A couple of years before, it hasn't been closed by the city council. So when we have showed this data to the people, to the citizens of the city, that it is important to have the sustainable decisions made for the sustainable development, and then we had the problem-solving decisions that might be still hard to close the school. Okay, thank you very much. That's a very interesting case, and of course, I guess maybe closing the school that's optimizing the city budget. It doesn't mean that the children are going to go to school. It means that they're going to have additional opportunity to do that. Okay, cool. Yes, that's right. But speaking about figures, can you please give us like the budget or whatsoever? If, as far as I remember, there was 870,000 plus on annual basis. We are now the first ones, one of the first ones, starting from January 1. All of the schools are going to be autonomous. This is the first time that we have turned all of our hospitals also to KMP, and our minister, our ex-minister, has been in Sambo, and she really she welcome Drogobych's decision, but it still has a lot of unpopular decisions, like the schools. There is a protest in the city council. There is like medicine. There is still the demonstration in front of the city council. But now when they see the data, they have a different argumentation. Even now we have already the different data sets, even like with the schools, with the energy efficient cabinets, so on and so forth. So if you have mistaken, show us where. Okay, the motto for our panel is going to be the open data are the cure for the populism. Okay, Stanislav, your plans as a leader, what are you going to do further on? Together with Visa, currently we are introducing e-tickets with this residential card, and we would like to open the data also for that, and we would like to explain to the people that the tickets in the buses, they cannot be free. So basically, the people, the taxpayers, they're paying for the transport, and we just want to show you how much money do we pay every month to the open data up to every bus stop. How much money do we earn at the public transport? So that the people, the residents of the city, would be aware that sometimes when they're coming, for example, when some of the politicians coming to the tribune and saying that we have to make the free of charge transport public transport, then we would have the arguments against it. Thank you, that's cool. We're really happy with your victories, because we would really like, first of all, to boast with your victories, and we would like to copy the decisions that you and solutions that you're making. So I would like to ask all of the people to follow what Stas Gaidar is doing with open data. Pavlo, the next question is to you. You do not represent the bodies of the national, regional level, but you are the person that started the first educational course for the public officials for the open data policies, and Ukrainian Catholic University has done it. So I have a lot of questions to you about the very first impressions after the launch that you made, why Ukrainian Catholic University has done it, and the most important issue, what is the motivation for the public officials and then your clients, the clients of your services, to use open data? Good day. Thank you very much for all of the good words. And if someone sees the problem, then we can see the opportunities and solutions. And if we are, because we're universities, then we're looking for the educational opportunities. And the question of the open data, and we have talked to Katya, and we also knew Andrei, and we also had this conversation that what's the problem? The data, everything looks so good. What's the problem? The question was how to work with data. And I have told them that let us make a program and let us tell the people how to work with data. So we just took that and did it. It sounds very simple, but we've started with an open data. And then we've turned to the format that this is going to be the policy-making program based on open data. And then we said that policy-making and visualization on open data. So we had 4 modules, 3 days, 6 hours, 16,600 hryvnias. The budget is allocated for 30 people. we had 80 applications, a 0 hryvnia spent for advertisement, and 25 participants in the end. So it's obviously, if people do not pay their own money, it's much harder to motivate them for studying. If they pay their own money, there's a fewer of them, but it's really also harder to motivate them. So it's hard to say whether the educational program was successful, because on one hand, first of all, the policies is something that doesn't really happen fast. It's like the education that's been done for perspective, but the policy making is something that doesn't have to be working as a final dogma. We can now build up the policies in order to protect ourselves from doing something. If you have the opportunity to capacities to first of all creating policies, but then again you have the flexibility to model, to update the policies, and everything is great then. But I do believe that despite the main ideas of it, whether there's the policies, how the way it is developed, that is still a learning game. But if you'll do it in a strategic wise, then as my colleagues have already said, you will succeed. We would like to have the second enrollment to the program. It's already being launched, and it happens here in Kiev, and this is the moment when we're following our clients' needs. And why are we doing this? I don't want to sound really loud, but I would like to say, I don't want to say that it's our mission. We're doing it because of money, and I'm not really afraid of speaking about money, even though I am a religious person and I am a worker of the university. A good thing should worth some money, but I know that the Eastern Europe Foundation also provided a couple of scholarships for the participants, and so if there is an issue, if you couldn't cover your educational course, then you could apply for a scholarship. If you had the opportunity, you could you could pay for your own course. Okay, thank you. I would like to ask you also, let us imagine ideal world that we are all aiming for, so that the decision makers how can we do that? That the decision makers would like to require this kind of training from you. So for them to start studying with us, yes. What can we do without giving them the money? Well, first of all, to ask them whether they have all the things blessed or no. But when we have created and designed our very first course, just the way we create the different policies, we created our course. We created the matrix of our course, and then we started discussing with stakeholders. A lot of people that I've talked to, they've told us that it's not going to happen. Like, look at this. There's 1, 2, 3, 4, 5 program. They're free of charge. There's all of the additional amenities included, and there's going to be like a big party afterwards. And now you are offering a lot of education, and it's not really cool and nice. And of course, I've even in one of the conversations that I've had, and there was one of the top public officers, and even asked her, like, please show me what this show me this program what it is. She shows me one, and I've asked her, are you going to participate in this program? And she says no. And I've said that yes, we're going to make a program that you'll be ready even to pay for that, and you will be ready to participate in that. It's not all that easy. And like, for example, from other analogies, we have launched a program for the charitable foundations in February. We had 145 applications. We only had 47 participants, and that's 22,500 hryvnias per 4 modules. But we have 37 motivated participants who were the owners and the managers of the charitable foundation. So if you offer a good product, you will find a good client.
So we wish you success and even bigger number of participants, the ones which are motivated to gain such knowledge. And especially I like the visualization project of a politician. Just think about that, visualization, a politician. I was trying to find a cool example online how I can find the case of visualization of policies which would unite the issue of healthcare, local development with the British hue. And I found the following, that the National Healthcare Service has lots of approaches from the British Healthcare Service, NHS. And I found the solution that in the city of Edinburgh, every part of the city has a map with the visualized forecast length of life according to each part of the city. People from the NHS took into consideration all the possible factors which impact the health of the people, including the economy, access to different services, environmental data, economic, ecology, social. They took into consideration the disease rate, and they calculated the base for the further planning of the development of the city, of the services, of any ecological issues, and so on. Such cases can become very soon a reality thanks to the work of such people like Pavlo, who provides the needs, and Stanislav and Oleg, who provide the policies at the national and regional levels. So when we are speaking about the health, when it's not working with the health, the people go to the priest. So take care about your health. I wanted to respond because Katsalut, we had the same system in Barcelona when we wanted to create the same. They had an interesting case when they showed in the parts of the city that not the genetics was the one which impacts, but the place where you live, where you reside. It was a very interesting research which really impacted, but I'd like to use this opportunity. If the Eastern Europe Foundation is paying internships, we as the Central Executive Branch would like to have several internships, because we'd like to train our people as well, and we will be grateful if we are able to do the same. Let's come to the American Embassy and ask them there. Okay, I wanted to add to Victor's words. You know, it's not always working when we have, when we need to successfully copy the Western experience, and not about the data. The zest is not in the policy, but because according to the values, the Ukrainian society is very wounded and vulnerable. When you mentioned about Drogobych case, when I used to be a priest, you could have plenty of arguments that it's rational to close the school, but there will be people who would definitely say yes, but no. This is the first point. Secondly, we have the problems with trust. We're saying this is the service working, another service is working, but we need to mean that we, the Ukrainians, will subconsciously think, where will they deceive me? Where will they cheat? And we need to understand it, not just to find compromises about the quality of the data, the structures of the data sets, creating the policies, but it always should be something which will be an inseparable element of the soul or style of certain politicians and policies. Because the matrix itself, as it is working in the Western world and very rational, maybe will never work in Ukraine. Still, it will be working, not when we want to live as they do in the West, but because we want to live with dignity and respect to one another. Super, thank you so much. This was our speech. We have 7 minutes for at least 3 questions. If you want to ask a questions, I hope that you do. So please introduce yourself and tell whom are you asking, and we'll get 3 questions and give you 3 answers very quickly. Someone is holding the hand. Please take the microphone. Would you help with the mic? Thank you so much. Hello, my name is Yaroslav Durguts. I've got the question to Stanislav Gaidar. We do remember how in Drogobych they organized the EQ to the kindergarten on blockchain, and then the state council said that this queue was totally for free for the city. Now Prozoro has 2 cases of 150,000 of hryvnia, which costs the implementation of EQ. Well, yes, you're right, but if you read more, one contract is not working and the money were not paid. And secondly, could you please tell, if you are having a gift of the car, will you make the one who gave you a gift to put some petroleum in it?
Okay.
Are there any other questions? No questions left. Then a couple of words now as a conclusion of what we can say about the results of today's panel discussion. Each of us is the participant of the policy formation process. We can give our feedback. We can take part in the assessment of the impact, of the possible impact of the state policy. We can aggregate, collect, and analyze the data. We can show our attitude towards this or that development of the state policy. We can take part in any counseling authorities' work to provide consultations with this or that stakeholder. And undoubtedly, we are those who get all the profits or non-benefits of the state policy. Each of us is interested for the process of the state policy to be as transparent, as inclusive, as adaptable, as efficient, as rational as possible, and so on. And I can go on with this list for a long time of all the requirements to the state policy, but still, we understand that the more data we have for the analysis of state policy, the more state policy is closer to us, the closer it is to us. I think our panelists, let's give them the round of applause. And I wish you success, and I really hope that in a year we'll present cool cases on how state policy has changed for the better thanks to the open data. Thank you so much.